Hello, Yellow.
You are tuned in to the Chatty Cat Pawdcast, a podcast created to empower pet owners with information needed to better care for their pets. This Chatty Cat Pawdcast is sponsored by Doodles Cat Sanctuary, where every cat is worth fighting for.
Dr. Singh and Jen are the hosts of the Chatty Cat Podcast, and we're all really happy to have you join us today. The listeners and viewers, hello, and tell us a little bit about the special friend you have on your lap.
Emmy is a cat we saved from New York City when she was left at the shelter being diagnosed with diabetes, and shortly after we got her, she started having difficulty walking. So now she's our happy little girl who loves to come here because she's purring.
We have had some amazing topics on this podcast in the past. If you missed those, make sure to check them out. Without further ado, today's topic is
urinary problems in cats and dogs.
So the animals have problems just like humans. That's what I'm learning as a pet owner. And there's a lot of things that you can do that is preventative, and sometimes things just happen where stuff happens, and you have to then treat them and go to the doctor just like a human being.
Just like a human.
So I guess start us off. What are some things as far as urinary?
There are certain conditions in cats and dogs which can put stress on the pet's health as well as the owner's pocket. The number one thing I would like to advise the pet owners is, when their pets are going for annual checkup, make sure you ask your vet to get a annual urinalysis done. That is the right time, and it's a much less expensive versus when your pet gets UTIs or urinary stones. Then it becomes really expensive, and your pet is going through that pain and suffering and inflammation. And they start peeing in the house, and they leave the smell in the house. And then every animal, when they smell the urine, no matter how deep cleaning you do, the smell still stays in the house, and they keep on peeing.
So it's not an expensive test. It's easy for the vets to do.
Is it literally just collecting urine sample and sending it to a lab to see what's all in
Yeah,
there?
even before you bring your pet, you can call and you can ask the vet, I would like to bring a urine sample. How can I collect it?
Mm-hmm.
Every vet can tell you, hey, get a container, wide container, and try to free catch.
Mm-hmm.
Yeah.
Free catch, put in a Ziploc bag, and bring
Obviously,
with you.
it's easier for dogs than
Yeah.
cats. But there, I don't know if this does anything with the reading, but there's plastic cat litter pellets.
Yes.
So you put in the litter and they don't absorb the urine. So then
The
you
urine's
can
just at the
collect from
bottom,
it.
and you can kind of drain it.
Yeah, you clean the litter box
Yeah.
and put those plastic pellets into the litter box and get the urine sample. And one more thing I would like to add, it is difficult to collect urine sample of a dog in a clinic than from a cat. We can collect the urine sample from a cat much easier.
That's interesting. I didn't
In
In
even
the
house.
actual clinic.
In the clinic, and that will be cysto, so you are taking a sample directly from the bladder, and that is the perfect sample.
Is that dangerous?
No, it is not dangerous if you know what you're doing.
Okay, because I've had vets that won't. They don't like to do that.
They don't do that, but I have been doing for last 30 years.
So that's just a matter
Wait,
of
it's
they're
a matter
just not
of-
comfortable. with
Doctor,
it.
how do you collect the sample then when the cat's here? Do you put pressure on the bladder?
If we have to hold the bladder,
Yeah.
and then we can use even ultrasound. With the help of ultrasound, we can direct
like
the needle.
Oh, so it's a needle.
It's a needle that goes
They don't
to the
even.
bladder.
They
they
don't
don't
even
feel
They
it?
don't feel it.
Really?
No.
Oh.
It's a very, very sharp needle. They don't feel. Urinalysis is one of the best source of information about pet's health. So many things you can rule out from urine sample.
Mm-hmm.
You can rule out diabetes.
Huh.
Okay, you can rule out infection. You can rule out if there's any high ketones level in the blood.
Mm-hmm.
You can rule out the pH. The pH tells us how health of the bladder is. If the pH is too low, the normal pH is 5.5 to 6.5 of the urine.
So that's like a more base, right?
It's like a neutral.
Neutral.
It's close to neutral. So if the pH is low, then 5 is acidic. It's very irritant to the bladder. And the chances of calcium oxalate crystal depositing in the bladder are much higher. If the pH is more than 7, 7.5, 8, then we are concerned about struvite crystals. That is the alkaline, that is also irritant. So this pH tells us a lot. And then there is specific gravity. Specific gravity means how much the urine is concentrated. And from the specific gravity, you can basically diagnose the health of the kidney. Because kidney is the main organ whose function is to concentrate the urine. Kidney does not allow extra fluid flushed out into the urine to make the body dehydrated.
Wow.
So if your the normal concentration of the urine is roughly 1020 to 1045, there's a normal range. But if your specific gravity is suppose 10-0, it's water. So you are drinking and peeing.
Wow.
Why it is water?
Yeah.
Why? It means the kidneys are not doing their function.
Not working. Yeah. They're not
They
holding
are supposed
water.
to conserve it. They have to take the water out and concentrate the urine.
Wow.
So and then you can have liver health also. Liver can do that too. If liver is bad, it makes the pet thirsty, and it drinks more water. And when they're drinking more water, your urine is specific gravity becomes diluted. So urinalysis gives you a lot of information.
Wow, and it's not expensive, so it's
It's
definitely
not expensive.
definitely something that should be done
Yes.
at least yearly.
Yes, if you cannot get yearly blood work done, at least get urinalysis done.
Okay.
The big thing is after you do the urinalysis, if there's any concerns, then you want to make sure there's no stones.
Before stones grow, the pH changes.
Okay.
Stones does not grow in a day.
Oh, okay.
It's a slow process. Just like you are building a house.
Okay.
You can't build a house. It's a brick by brick.
Huh.
So same way, stone is crystal by crystal.
The symptoms are they pee and it's normal, and then all of a sudden they're in and out of the box like crazy. There's blood in the urine. So you visually see it like that.
Yes.
Already when they got the stones, and it's too late.
But if you go down the lane in your memory, that cat will start showing symptoms 2 or 3 weeks before you see the blood.
Huh.
Okay.
The first symptom when that stone, first of all, you're missing crystals.
Okay.
You miss crystals. So you didn't go to the vet. You didn't get your...
So the crystals turn into the stone.
Crystals turn into a stone.
Okay.
So if you would have catch those crystals early, you would have changed the food, because food is the main source for those crystals to build up in the urine.
It changes, it messes with your pH.
pH, it messes with the pH, and the ash content of the food turns into crystals.
Wow.
Like a triple phosphate. Triple phosphate is also called struvite crystals. There are 3 different kind of phosphates in the food, which when they get digested, they are digested and go to the blood, filtered by the kidneys, and those turns into crystals. And if you get the urinalysis done and you find out, okay, there are struvite crystals in the urine, the vet will tell you, hey, you what kind of food you are feeding to your cat, because we are seeing crystals, and well, your cat is potential risk of getting crystals. Let us try for struvite. He will say, let us try low pH food, and there are low pH food available on the market.
Gotcha.
And now I will try to explain what is the pathophysiology of block.
Okay.
It's a disease of not mostly 100% male cats. The female cats doesn't get blocked.
Huh.
Female cats can get UTI infection.
Okay.
And because they're what is it called?
The aperture, the orifice, the vagina is wider, urethra is wider.
Okay.
So if the crystals are formed, still those crystals pass.
They'll pass.
They're not gonna stuck.
Okay.
They still hurt.
And you'll
They
still hurt.
Still bleeding and
Right.
stuff?
Yeah.
Yes.
Okay.
Blood will there, inflammation of the bladder
And the
will
infection,
be there,
yeah.
infection will be there, but they will not get blocked.
Okay.
The only symptom you will be seeing, they will be peeing in appropriate places, and they are so smart animals. Sometimes they will pee on a white surface, like a white ceramic, like a tub, bathtub.
Yeah. They do.
So-
They will start in
So
the
they
bathtub.
want to show you, hey,
Oh.
I am peeing blood.
Wow.
I need help.
Wow.
I have heard that so many
Yeah.
times.
They start going in the bathtub. Yep.
They
Huh.
go in a bathtub. They will not go to the carpet or anything, but they will go in a place where they will.
See it.
Or the sink.
Yeah.
They'll start.
Sink.
They'll go in the
Wow.
sink too. Hmm.
So then you see the blood, and that time owner comes to the vet.
Can keep track.
So what you want to look into litter box?
Mm-hmm.
Obviously poop.
Yeah.
You can't miss that.
Right.
But size of
The
the
size.
of the pee.
Oh.
Every pet owner knows how much my cat pees
Yeah.
because they clean
They
it.
clean it.
They clean
The
it.
clumps come out.
The
Yeah.
clumps come out. They see if the day you feel that the size is decreasing, then pay attention to that.
Okay.
Mhm.
That's the time to pay attention. If you ignore that part, then within a couple of weeks or a month, you are facing a problem.
Okay.
If you don't get
Holy
it treated.
cow.
Depending upon how much the pet owner is aware of this situation, there are stages: stage 1, 2, 3, 4. 4 stages when the cat start vomiting because that urine now is going back into the kidneys
Wow.
and burning the kidneys, and then the urea in the blood start going high, and the brain starts sending message to the vomiting center,
Uh-huh.
and they start vomiting.
Wow.
So when the owner saw vomit, and then he said something is wrong, he's coming to the clinic as a vomiting patient.
Yep. Not a
Oh,
urinary.
Not a urinary
right,
blockage.
Wow.
He's still there are owners who will think, I don't know, my cat is vomiting.
Mm-hmm.
Then I will feel the blood, so this cat is blocked,
Yeah.
and that's why it's vomiting. That is stage 4.
That's the worst.
So he missed 1, 2, 3 stages. Those are very obvious stages. A little pay attention, then you will not miss those.
Can you go through the stages?
Like stage 1, when the size of the urine is decreasing.
Oh, decreasing. Okay.
That is stage 1.
Yep.
You saw the size. Okay.
Crystals building up and kind of holding it back.
Then you will see one time the cat peed outside the box,
Ah.
and owner said, I don't know, maybe the litter box was
Had an
dirty.
accident. Yep, exactly.
That's an accident. That's not an accident.
Okay.
That is something he's telling you.
Okay.
And third stage is when cat is going to the box and coming out, going to the box and coming out, going to the box and coming out. He is trying to pee, and owner missed that.
Mm.
Whether the owner was working,
Mm-hmm.
and the cat was going into the box
But
and
couldn't pee.
could not pee, and that is the third stage.
Yeah.
Stage 1 is the most easy stage, very least expensive.
Okay.
What you have to do basically, urinalysis, antibiotics, some pain medication.
Yeah.
We have to control that pain
Yeah.
because the bladder is painful, and cat, as soon as is pressing the bladder to
Mhm.
pee, feeling pain,
Mm.
doesn't go to the box
Yeah.
and try to like hold it.
Yeah.
And we give the pain medication. We gave some antibiotic. We can culture the urine. The vet can culture the urine also.
Stage 2 similar still?
Stage 2 is still similar. We can save the cat by giving pain medication and antibiotics, but I will give the red flag to the owner. Stage 2 can convert into stage 3 very fast. I will tell the owner, look, this cat is not blocked yet, but that doesn't mean it cannot.
Mm.
So if this cat doesn't feel, you don't see the large amount of urine in the box, bring it back. We may have to pass a catheter.
Okay. And that's to clear the blockage.
Clear the blockage, bring out all the crystals.
This Chatty Cat Podcast is sponsored by Milwaukee Walk-In Vet Clinic, home of the no hidden price policy.
We're currently talking about urinary infections in cats and dogs, and we kind of covered a lot of cat talk. Are dogs very similar?
Dogs are similar. Urinalysis to be done, and crystals are same.
Is it as frequent in dogs?
Yes.
Oh, really?
Same.
Okay.
Same.
Same thing caused by pH levels?
pH levels.
Okay.
And quite similar to the cats. Cats rather have more issues with bladder.
Why is that?
They don't drink as much.
Yeah, they don't drink as much. Yeah, she got it right. Yes, they don't drink as much.
It's funny because I was talking to someone, I forget how this came up, and she said, my vet asked me if my cat drank water, and my friend, her cat is blocked a different way, and she said, I don't even know the last time he drank water, and I have done that too. Like I have cats, I'm like, I don't know when they drink water. They almost never drink.
See, you rarely see them drink.
Especially I feed my cats wet food, so it has a lot of moisture in it, so they don't really need water.
Yeah.
But I clean my water bowls out every day just to keep them clean, but there's no water missing. It's not like a dog where
constantly, no. all over the bowl, water everywhere.
That's a lot of it, I think, is that.
Is it the same thing with female and male dogs where one can pass and the other one gets blocked?
Yes.
Okay.
Similar.
Similar anatomy. Interesting. Let's have some fun. Let's ask each other a couple trivia questions. Can be personal, can be animal related.
Okay.
Dr. Singh, if you want to go first, try to. The goal is to stomp each other.
Oh no!
I will ask. I will ask Jen a veterinary trivia question.
Okay.
All right. And it is basically for internal sutures.
All
right.
Oh, and I saw him do these,
sutures.
so I better know the answer.
Yeah.
And what is an internal suture?
Whenever you are doing surgery inside the body, not outside.
Okay.
So what kind of sutures mainly you use? I will name 4.
Okay.
And I'll see.
They're purple. I don't know.
No, Jen can figure it.
See if she can get it. Okay.
Yeah.
Okay.
All right. So those sutures which we use internally, whether they are made of nylon, cotton, surgical gut, or metallic wire.
Oh my God, I don't know. I would say nylon, but I don't know.
Nylon will not be absorbed.
We wouldn't what?
It has to be surgical.
Yes,
right, okay.
surgical gut. Surgical gut.
Surgical gut?
Gut. Yeah, gut of other animal.
Okay, I did not know that.
So
I just figured it's surgical, so it has to be.
So that can be used
That's
internally.
the purple one?
Yes.
Oh.
So that can be used internally.
That's how come it dissolves.
They can dissolve, yes.
Wow.
Okay, second one.
He can ask the questions.
So, how long it takes for those internal sutures to get dissolved?
Dissolve?
An option is 1 year, 6 months, 3 months, 2 years.
Whoa. Okay, Jen.
I was going to say 6 weeks, so I'm way.
Oh, yeah. Well, there's a close one. There's 3 months. Sounds like
3 months.
3 months. 3 months.
Did I?
Okay.
Ding. All right, cool.
I like these. I like this veterinary question and answer.
So should we do one more from you, Singh?
Yeah.
All right.
So, what is an ovarian hysterectomy public word? Ovariohysterectomy. That is called decline. That is called spay, or that is called neuter.
Spay. We talked about
hysterectomy?
Ovarian hysterectomy.
Yeah, you did mention that, I think, in one of the first episodes.
Yep.
Yes. Okay. Ding. That's 2 out of 3.
Yay.
That's pretty good, Jen. Look, you're almost there. All right, now it's on you. What do you got? What do you got for Dr. Singh?
I have no questions.
Well, Dr. Singh used the phone, but maybe stomp him with a personal question. Does he know a lot about you?
Well, you know what's funny? He mentioned how many cats I have. And he was actually wrong.
Okay, so there you go. Let's do this. So, Jen's question for Dr. Singh is...
How many cats do I really have?
And what are the options? Kind of
all
over the board.
Options.
Well, he said 30, and I'll go with... So it's either more or less.
Oh, come on. That's not fair. Give us 3 numbers, not 30.
Okay, so not 30, 25, 40, or 33.
I'll go with 33.
Okay.
Did he get it?
I know.
Ding. It's not 40 yet, right?
It was close.
It was close at one point.
Well, when midnight was there, it was close.
Yeah.
This actually reminds me. So Doodles Cat Sanctuary is a nonprofit that's taking care of all these cats. So please go on their website and donate. All of that money goes to helping these cats have a healthy lifestyle and live out the rest of their lives. Instead of being forgotten and forgiven, put down, whatever. So make sure you go to Doodles. What is the website?
Doodlesranch.org.
Yeah, make sure you go there and donate to help give these cats a nice life.
No, I would like to add and ask my audience that the job Jen and Mark are doing is wonderful, wonderful, out of this world. They are not ordinary rescue people. They are special, very special people who are giving a chance to those cats. If they don't do that, they're going to put to sleep.
Yeah.
So their efforts are unremarkable, and whatever help you guys can do to this Doodle Ranch cat sanctuary.
Every dollar counts.
Every dog counts.
Every dollar counts.
Every cat counts.
Well, there's one more thing I wanted to, because this is something that we learned today.
Sure.
Because I didn't know.
Oh yeah, what do you got
so
over here?
this is something they make it for dogs too,
Yes.
right?
Cosequin.
Cosequin.
It's called Cosequin.
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 Okay.
And
For cats and dogs.
yeah, so
What is it?
it's for inflammation, and
Yes. It's a anti-inflammation, like a glucosamine, MSM,
Okay.
chondroitin.
These
These are basically anti-inflammatory drugs
for internal organs.
for internal organs.
Okay.
Whether it's the inflammation in the joints, which causes arthritis pain,
Okay.
whether it's the inflammation of the bladder causing bladder pain, it helps to relieve that pain.
And what do you use that for? I mean,
yeah,
anti-inflammation.
so
in
a
your
lot of
case.
people use it for the urinary bladder inflammation. So-
While you're going through treatment, you can use that to relieve some pain.
You can regularly use it.
Oh, really?
Yeah.
If you have an old cat,
Yeah.
suppose you are more than 6 years, 7 years
Yep.
old cat,
Mm-hmm.
that cat will happen arthritis in the hips. That cat can get UTIs. So it's like a vitamin.
Oh, so you could actually just start giving it
Start giving it-
regularly after like 6 or 7 years of
Yeah,
cat
start,
age.
open the capsule and sprinkle that content on the food,
In the food.
and they are chicken flavored,
Got it.
and then the cats love it, and
Wow.
your cats will be healthy.
Okay,
And
that's
a lot-
good to know. Our
I
cat's
know-
actually like 11, so we better start giving
Yeah.
it. Okay.
It's not very expensive either, and even though it says joint health supplement, but like Dr. Singh was saying, they
There's a lot
use
more
it a lot
stuff.
for the inflammation in the bladder
Got
when
it.
there's urinary thing.
Well,
This
that's
is
great
like a
to
big
know.
thing. Yeah.
I'm gonna pick some up. What else you got over here on the table?
Well, this was just one thing that I wanted to say because I think it's important because the urinary food we have Dr. Singh uses Hill's CD.
And that's what you put them on once they get the infection.
This is for long, and it could be for long term.
Or-
This is long-term food,
okay.
regular food.
Okay.
Once your male cat got diagnosed with crystals,
Yeah.
okay, now you don't want to face that situation again.
Right.
So I will put my cat on this food forever.
Got it. Got it.
But the thing that I wanted to mention, because I didn't know this when I first had a problem, so all the companies make different kinds, but this is not the same as this. So you think it's the size? So some I got, it's like, this is like a pate, and this is like a more like a stew,
Okay.
Yeah.
Got
right?
it. Yep.
So the first time I ever had it, I used the pate, and some cats don't like it as much.
Yes.
So you get frustrated because you're like, oh my God, they have to be on this food and they
And they're
don't
not
like
eating
it
it.
and they don't want to
Yeah.
eat it. And then if you try this, then they might eat it. So that's just an important thing for me to share because, and then there's different companies. This
Yes.
is not the only company, and it's the same. They're
same.
They
big.
have different sizes, but they're actually different
Exactly,
foods. Now,
exactly.
is the serving portions different? There's like 4 servings in one and only 2 in
Yeah.
the other? Okay.
Yeah.
So you just have to buy more,
Yeah.
and the price was probably accordingly.
Right.
You
Okay.
price accordingly. There is a other cat food called NF, Purina NF.
Okay, yep.
That's also good food.
Okay.
So
And my cats like that.
Yeah.
They make
Purina
a good.
enough.
yeah,
Purina makes the big can, the 5
Uh-huh.
ounce can with like, I don't want to say gravy because it's not like a
No,
gravy
liquid,
diabetic
yeah.
like that. The diabetic cats are going to go
Mhm.
crazy, but it's like a moist. It's more juicy.
Mm-hmm.
So that one they like a lot, and it's a fish flavor, which
Cool.
so it'll
Yeah.
it'll entice them to eat it. But I just think that that's important because a lot of
Yeah.
times.
cats
When-
don't like it.
Yeah, if
Particular
your vet,
food.
if you don't think to ask your vet, you know,
Yeah.
if the vet just says, "Oh, here's the
try both.
try-
'cause
yeah,
one
you-
may be
right,"
good. One
and
may
then
be
there's
bad.
also the dry food.
Mm.
So if you can't get them, because a lot of cats, unfortunately, as for some reason we always thought cat. Even growing up, it was always dry food.
Right.
You just buy the bag of dry
Yep,
food.
yep.
It's cheap. It's whatever.
Yep.
You just leave it there.
Yep.
But now they're getting so many problems. So I always tell people when I do adoptions, I always say, if you want to feed your cat dry food, fine, but
Mhm.
please
Like mix.
incorporate the wet food somehow,
yeah.
even if it's once a day or twice a day. Just get them used to it because there are times when they need the wet food.
They'll have to eat that. Yeah.
But if you have a cat that won't eat wet food, you have an alternative too.
Yeah.
There's the urinary dry food is meant to help them too.
Got it.
So,
and what's the other thing you have on the table here? Is that something you wanted to bring up?
Same thing.
This we found out is the same as the
Oh,
glucosamine.
okay.
Same glucosamine and MSM.
Just a different version.
This is just
Different
called
version.
bladder support.
Gotcha, bladder support.
So one thing I would like to add in the end, the basic rule is make sure your cats are drinking. If they're drinking water, you will have healthy bladder.
So make a point on watch the water levels.
They
If
say-
you see them drink, make a mental note.
If they're not drinking from a regular bowl, so I have one
because
cat.
sometimes they go to the sink.
So
Yeah.
so
Okay.
pet fountains is a big thing. Different fountains. Like if they don't use one fountain, this is the thing with cats. Just like this, if they're not going to eat this food, they might eat this food. If they don't like the fountain that flows this way, they might like one that comes up like. And then
Wow.
and then
Yeah.
I have one cat that he likes. I took him. Someone surrendered him to me for being diabetic. He has the they're like freezable ice cubes.
Yes.
Like you put in but they're not ice cubes. They're like plastic, and they have the inside freezes if you put them in the freezer. But anyway, we put them in his water bowl.
And he likes those?
He likes to play with them, so it makes him drink water.
Huh.
So
Or
Interesting.
other thing you can do is
ice cubes too, though.
ice
some
cubes
cats.
too.
Mhm.
You can also sometimes start adding little tuna juice into the water.
And they smell it and
That's
they
right,
like it.
tuna, that's like it.
Wow.
Or even add water into if you feed them wet food. I think you can add water to dry food, but
Yes.
you can't leave it.
Then if it is not done, then you have to remove
Yeah,
it.
you have to
Gotcha.
remove it.
Yes.
Same thing, this is a little bit off topic, we talked about it prior, but for dental care, you can put some of that dental additive to take
Yes.
care of their teeth.
Yes,
Yeah.
we can do that.
I
too.
started doing that for the dogs, and they seem to like the water just fine. It's
Great.
So hopefully it's helping. So.
Absolutely.
Awesome. That's great. Well, Dr. Singh and Jen, thank you so much for all the information and all the great Chatty Cat conversations. And, if you're just tuning in now, you're too late. So make sure to hit rewind and listen to what we talked about. This is the Chatty Cat
bye, Em.
Pawdcast. We're going to tune out
Wanna say bye?
until next week. Make sure you follow us, donate, and support. And, if you don't have a vet that you regularly visit, make sure you become friends with one of your local vets because it's very, very important, as I'm coming to find out. So go ahead and do that. And, Till next time.
Bye-bye.